Hi, I'm Dr. Vanden Bosch with the V Boutique. Today I am with Ruth, who's a 58-year-old beautiful woman who I have done one session of Sculptra before. This is her second session, so that's what we're going to talk about. Sculptra, as you can see over here, is a product that is pretty much in the form of liquid. It comes in the form of a powder. We mix it with sterile water, and then we get several vials of basically fluid that's slightly cloudy, and that's because of the polylactic acid, or PLLA, which is the active ingredient. When we inject Sculptra into the face, it's very different from other forms of dermal fillers. Sculptra is not really a dermal filler, it's a collagen stimulator, and it's an anti-aging treatment. But it acts as a filler because of the degree of collagenesis and such that you get a large amount of volume production with it. And because, as you can see, with every treatment we get multiple syringes, we get a nice amount of product to work with. So if a face has global volume loss, what I call it, or multiple areas that need to be treated specially, this is a really good product. It's also very good because it gives a very natural and long-lasting result. It's FDA approved for 2 years or more. And in clinical studies, over 80% of people were already satisfied still with the results. The treatment is also very natural because the results are gradual. Usually it takes about 3 months to see the optimal results, and sometimes up to 6 months you get continued improvement. And then you plateau, and then you're good to for about 2 years, and then after that you just do a little maintenance. So all of those make this a really, really favorite product of mine. I've had it multiple times myself, and it's very nice. It also helps with tightening of the skin and lifting because, again, it's a very potent collagen producer. Now, she's had it once, and the first time I usually say you don't see a lot of results because you usually need 2 or 3 sessions to get the optimal result depending on the volume loss. But you already saw a difference, right, after the first treatment? Yeah. So with her, we decided to do Sculptra, and I'm just talk a little bit about her face because she has what I call global volume loss. And if you look, you will see her temples are pretty sunk, and also her chin in here is pretty hollow. So that kind of shadowing in the chin is a sign of significant volume loss, which is very typical of women. She's also very hollow in piriform aperture in here in mid and medial face. So when we look from the side, we can see that she has a lot of forward projection in the lid, but around her nose in this area in the mid face is pretty regressed. So bringing a little forward projection in the mid face here and in the chin where she's lost volume will bring a lot of balance to her face. Also, when we look from the front, we can see that she has fairly decent bone structure in terms of the cheekbones and the brow bone and even the mandible, the jawbone, but there's not much tissue on top of that, so everything looks sort of a little pointy and not so soft. So, and that kind of makes us look aged. She's thin, she's in good shape, but she just doesn't have a lot of facial volume. So with Sculptra, we can actually put a little padding all over. We can fill her temples, we can address the volume loss in her mid-face. Sometimes we can sort of show that even better with bending the face down. We can see in here, mid-face and the cheek area, we've lost a lot of volume. So filling this up with a little bit of Sculptra can give a really natural, beautiful result. And also in here. So I'm gonna start. You scoot over a little bit towards me because I'm kind of, okay, thank you. I'm gonna put that behind your head. So I'm gonna start in her temple. I'm just gonna show one side of the face, and 1, 2, 3, ouch. You okay? Mm-hmm. So there's a lot of lidocaine mixed with this product. Her face has already been thoroughly cleansed and numbed. And there's also lidocaine mixed with Sculptra itself, which makes the procedure very comfortable. How was that? Not too bad? Mm-mm. Okay, great. So that was just the temple. It already looks a lot better. Chin up a little bit for me. Thank you. I'm going to address that area that I was talking about, piriform aperture. Mid-face, this is a little sensitive, but she's a pro, she's awesome. One of the great things about this product is because of its liquid form, we have the ability to withdraw with the needle through the syringe. That allows us to make sure we're not inside of a vessel when we get no flow back. That really helped with that. Give me a big smile. Okay, good, relax. So now we're gonna address her cheek. Sculptra is the only product that we need to massage afterwards. You okay, honey?
Mm-hmm.
Usually recommend massaging the face just very gently with your fingers for 5 times a day for 5 days, 5 minutes each time. Now I'm addressing the mid-face. Looks really nice. You can already see the change. These always look a little exaggerated because of the amount of water that's in the product. The water gets absorbed and then collagenesis starts. I'm injecting what we call the buccal space, because we tend to get hollow in there too. And then we're going to do her chin. This is a typical area for women to lose a lot of volume. I'm sorry, that's a sensitive spot. Beautiful. That's it, we're pretty much done with this side. So these are temporary results because of the degree of water that's in there. And this, what I say, is usually gives you the preview. So you can see what you can expect after 2 or 3 treatments in about 3 months. This is kind of the result you can get. You can fill out the temples, get rid of that hollowness, bring your cheek forward and out. As you can see here, lift the mid-face as opposed to this. When you look at the bird's eye view, we can fill out the chin and give that overall sort of soft, rounded look without any exaggerated features or anything that makes you look you had work done. That's why it's so beautiful and natural. If you can address the whole face as opposed to one area where a lot of people focus on just the cheek or just the lip, that's what gives you the natural result, because when you age, you don't age just in one part of your face. Your whole face ages. So the way to make it look natural is to get the whole face more or less to follow that same backwards motion and sort of unage at the same rate. So, you okay?
Mm-hmm.
So we're going to continue on the other side
Okay.
now. Thank you.